Hey everyone, welcome to our channel, your channel, Body Bite Insights. Some of you might well remember this documentary about the spinal cord, your spine, facts that will blow your mind. If you haven't watched it yet, please do as soon as possible. The link is in the description. Today we're going to talk about a specific area of the same subject, the curvatures in the spine. It's pretty amazing. It holds you upright, lets you bend and twist, and protects your spinal cord. The spinal cord is like a highway for your brain, sending messages all over your body. Your spine is made up of small bones called vertebrae, stacked one on top of the other. Between these vertebrae are discs, acting like cushions and allowing for movement. Think of them like shock absorbers for your body. A healthy spine has natural curves, which are super important for balance and flexibility. These curves help distribute your body weight and absorb shock. Pretty cool, right? Taking care of your spine is crucial for your overall health and well-being, so let's dive in and learn more about this incredible part of your body. Now let's talk about those curves in your spine. Don't worry, they're supposed to be there. In fact, they're what give your spine its strength and flexibility. Looking at your back from the side, you'll notice two types of curves: a C-shaped curve in your upper back, thoracic spine, and a reverse C-shaped curve in your lower back, lumbar spine. The curve in your upper back, called kyphosis, helps you bend forward. It's what allows you to hug your friends or reach for your toes. The curve in your lower back, called lordosis, helps you stand upright and maintain balance. It also absorbs shock when you walk or run. These natural curves are essential for a healthy spine. They work together to support your body weight, allow for movement, and protect your spinal cord. Sometimes the spine can develop abnormal curves. These curves can be present at birth or develop later in life. While some may be mild, others can cause pain and affect mobility. One common abnormal curvature is scoliosis, where the spine curves sideways. Imagine an S or C shape instead of a straight line. Scoliosis often develops during childhood and adolescence. Another type is kyphosis, an excessive forward curve of the upper back. This can give the appearance of a hunchback. Kyphosis can be caused by poor posture, aging, or other factors. Then there's lordosis, an excessive inward curve of the lower back. This can make the belly stick out and put stress on the spine. Lordosis can be caused by pregnancy, obesity, or muscle imbalances. It's important to remember that not all spinal curvatures are severe. Many people live normal lives with mild curvatures. However, it's crucial to seek professional advice if you notice any changes in your spine or experience back pain. Now let's dive a little deeper in what really causes these abnormal spinal curvatures. Well, it can be a bit of a mystery sometimes. Some curvatures are present at birth while others develop later in life. Genetics can play a role, as can certain medical conditions like cerebral palsy or muscular dystrophy. Poor posture, especially during childhood and adolescence, can also contribute to abnormal curvatures. Injuries, infections, and even tumors can affect the spine and lead to curvature problems. It's important to be aware of the risks and take steps to protect your spine. Now, how do you know if you have a spinal curvature issue? Well, back pain is a common symptom, but not everyone experiences it. You might notice uneven shoulders, one hip higher than the other, or a leaning to one side. If you experience any of these symptoms, don't panic. It's important to see a doctor to get a proper diagnosis. They can determine the cause of your symptoms and recommend the best course of treatment. Diagnosis and treatment: finding the right path. Diagnosing a spinal curvature usually involves a physical exam and imaging tests. Your doctor will check your posture, range of motion, and look for any abnormalities. X-rays are commonly used to visualize the spine and measure the degree of curvature. In some cases, other imaging tests like MRI or CT scans might be needed to get a more detailed view. Treatment for spinal curvatures depends on the severity of the curve and the underlying cause. Mild cases might not require any treatment, just observation and regular checkups. For more significant curves, treatment options include bracing. Wearing a brace won't straighten the spine, but it can help prevent further curvature, especially in growing children and adolescents. Physical therapy. Exercises and stretches can help strengthen muscles, improve posture, and alleviate pain. Surgery. In severe cases, surgery might be necessary to correct the curvature and prevent further complications. Remember, every case is unique, and your doctor will recommend the best approach for you. It's essential to have open communication with your healthcare provider and ask any questions you may have. Before going ahead and sharing some tips for life with you, we want to take the time to thank you for keeping watching until now. We deeply appreciate. Remember to like and share this content with those you know would appreciate it as well as you do. While not all spinal curvatures are preventable, there are things you can do to keep your spine healthy and strong. Remember, a healthy spine means a healthier you. Maintain good posture, stand tall, sit straight, and avoid slouching. Imagine a string pulling you up from the top of your head. Lift properly. When lifting heavy objects, bend your knees, not your back. Keep the object close to your body and ask for help if needed. Stay active. Engage in regular exercise that strengthens your core muscles which support your spine. Swimming, yoga, and Pilates are great options. Maintain a healthy weight. Excess weight puts extra stress on your spine. Eating a balanced diet and exercising regularly can help you maintain a healthy weight. Get enough calcium and vitamin D. These nutrients are essential for strong bones, including your spine. Dairy products, leafy greens, and fortified foods are good sources. By incorporating these tips into your daily routine, you can promote a healthy spine and reduce your risk of developing spinal problems. Your spine, your health, a lifelong journey. Remember, your spine is an integral part of your overall health. Taking care of it is crucial for living a long, active, and pain-free life. Understanding the normal curves of your spine and being aware of potential problems is the first step. By following the tips we've discussed, you can help keep your spine healthy and strong for years to come. If you have any concerns about your spine or experience back pain, don't hesitate to seek professional help. Early diagnosis and treatment are essential for preventing complications and maintaining a healthy spine. Stay straight and stay healthy. If you found this video useful, show your support with a like, subscribe for more health tips, and share this video to help others care for their spines.